You'll remember her from earlier, a few weeks back. Child psychologist Dr. Jillian Roberts is in Victoria, in with us this morning and going to be right through until the end of our program. We're glad to see you again, Dr. Roberts. Thanks for coming back.
My pleasure.
I was wondering, I'm just interested before we get to a number of viewer questions already, Dr. Roberts, but just to pick up on what Michael Serapio has been talking about, because there are parents maybe preparing to send their children off either this morning or tomorrow or Wednesday as this starts to roll out across the province. What is the best advice to parents sort of to prepare their children for the return to school after these many weeks?
Well, I think it's important, first of all, not to scare them, to make sure that you feel confident that they're going to a safe place and that the school has done everything that is needed for them to be safe in that environment. It's also important to go over the social distancing requirements and the importance of complying with them. So to follow the teacher's advice and to wash their hands and do everything that the school is asking to keep them safe, but to do all of this within the spirit of joyousness and celebration, so that any worry that you might have in your heart about your child leaving that sort of protective bubble of your home, that worry isn't given to your child, that they don't feel your fear and pick up on that and kind of ruminate on anything that they might be sensing from you.
Is it important to do ongoing debriefing too, maybe when they come home from school today or later in the week? Because I'm just thinking everything is going to be so different and they're not going to be allowed to just play with their friends and hug their teachers and go through the normal routines, and that might be a big adjustment for a child too.
Absolutely. I'm a really big proponent of bookending your child's day. So to have that sort of pep talk in the morning and then a lovely debrief and parent-child connective time at the end of the day, where you can talk about the day and what came up and what the teachers were doing and what they learned and the most fun they had, so to try to make sure that the experience is framed and in as positive a way possible for your child.
Questions specifically about what the children are feeling as we begin to answer some of our viewer questions, Dr. Roberts, this morning. Deborah is wondering about, is there too much fear being put in? You mentioned afraid. Is there too much fear going into children's heads? And how does a parent find the balance between educating children yet assuring children that it's going to be okay?
Well, I think the number one rule there is to not talk about your own fears, adult worries, in front of a child. So if you're worried about income, paying rent, having enough money for food, that type of thing, that should not be done around your children's ears. They don't have the capacity to handle that level of worry. However, if you're talking about what we need to do to stay safe, washing our hands, wearing face masks in public, making sure we're socially distant, or when we're out going to school that we're keeping that many feet behind the next person in line, I think that safety-related conversation is fine. We want children to be vigilant, but we do not want children to be worried about what their parents might be worried about. Keep adult worries in the adult realm and allow the child to be vigilant about things that are in the child realm.
And similarly, although it does give us an opportunity to talk about warning signs, Dee Lynn is writing to say that 11-year-old son has grown increasingly moody during this pandemic, and Dee Lynn is concerned he's going to lose his ability to relate to other children due to spending too much time alone. So the question from the parent is, how can I manage this, and is it something to be concerned about? Which makes me think we might look to warning signs if there is anything to alert a parent to something going along.
Right. Well, when a child is irritable, that's a sign of, like a beginning sign of depression. Adults will often experience depression as weepiness, really depressed affect or mood, whereas what we see in children is irritability. So what I think that behavior is signaling to the parent is that perhaps that child needs someone to talk to. And there's a lot of wonderful virtual online child therapy options available right now. Regarding the second question about the child losing their ability to relate to other children, I would not be worried about that at all. Children are incredibly resilient. you'll put them back in that environment, and you're going to see them, there might be 1 or 2 minutes of awkwardness as they sort of get used to children that they hadn't seen in a couple of months. But I think you can expect children just to, hit the field running, so to speak.
Bounce right back into those friendships. That's interesting, though, because missing friends is one of the big concerns that children are saying in a new poll that we're talking about today as well. And when you come back later in the hour, Dr. Roberts will have more to ask based on some of those, the anxieties and the big concerns and the worries as reflected in this new Angus Reid poll. Let me just ask, as you were listening in, as I was introducing you with some of these findings from the Angus Reid survey, it is a really interesting one. These are children, 10 to 17, Dr. Roberts. And again, their big worry, missing out on school, either current or next year. Secondly, is their family members, and specifically their parents, getting sick. And thirdly, their parents losing work or having lost already work. Those are the top 3 preoccupations. What are your thoughts on those issues as they're reflected in this survey?
Well, when it comes to the worried about parents losing work, I would be really cautious that parents take those conversations outside of little children's ears. That means little ones have been overhearing something, and that can be alarming for them. It is very common for children of all ages to be worried about their parents' health. And what that really does show is that parent, mom and dad, have created a beautiful, strong attachment with that child. That child loves that parent. And so that's a normal fear. I think parents really need to do a good job of reassuring their child, making sure their child understands that they're safe. They're not stuck at home, but they're safe at home. I think that is what I would recommend to families.
From viewers, let's turn to those next. Dr. Roberts, Raina is wondering if it's okay to give some responsibilities to her 8-year-old, helping her 5-year-old staying busy at home. Both Raina and her husband are still working from home all day, and this is a real juggling act, isn't it, for parents right now? But she's wondering if that's okay to let the 8-year-old help the 5-year-old. Are there any psychological implications that Raina should be aware of?
Nope.
Well, that's a short one. So it's that's
yeah.
just fine? Like, what kinds of things would be fair for the 8-year-old to do?
Well, I wouldn't want the 8-year-old, necessarily to, be helping with toileting or, something like that if possible. But I think playing, working on reading together, doing art together, playing in the back garden together, I think it's perfectly fine and perfectly natural for children of that age span. And I don't think it hurts to give a child a little bit of responsibility. I mean, I wouldn't want that child to be left alone with a little one without any parent in the home. I mean, that would be a line not to cross. But if a parent is in a situation where they need an older sibling to step in right now and help a younger sibling, I see no problem with that whatsoever.
Fantastic. And Raina, thank you for the question. We're getting quite a number of questions, Dr. Roberts, from people wondering about shared custody arrangements and what is working best going back and forth between households at this time. So Mark is maybe one that encapsulates a number of questions, wondering about best advice for parents who have a shared custody agreement, what to do in terms of how to best handle the child sort of emotionally and psychologically, but also what to do if one party is adhering to the self-quarantine rules more closely, one is ignoring them, that difference of opinion and how it might be seen and interpreted by the child.
I would say the number one challenge that I see in child psychology is parents not being able to get it together and co-parent effectively for their children. In some way, bringing into the co-parenting arrangement control issues that they had prior to the separation and divorce. And my response to parents is this is your responsibility to get this right. Your child's welfare is the number one priority. Keeping your child emotionally well and physically and safe, that's your number one priority. And so, this is an opportunity to press the reset button, make a decision with your former partner to do things differently in the best interest of your child. The second thing that I would say is both parents need to speak with that child every day if possible. I'm a big fan of bookending the day. Both parents should have a check-in in the morning. Both parents should have a check-in at night to maintain that child-parent bond and to secure that attachment over time.
When you say parents should have the welfare of the child, number one priority, that's coming through loud and clear in a question from Mike, who says he's a single dad in Ottawa and is concerned about his 3-year-old daughter. How many hours a day can my 3-year-old play by herself while I'm working from home? Is it all right to say no sometimes when she asks me to play with her? It makes me feel guilty, Mike writes. I want her to learn independence, but don't want her to feel ignored or abandoned. Some suggestions there?
Well, a 3-year-old is a really young child to be on their own for an extended period of time. Every single hour, I would be encouraging that dad for 15, 20 minutes to stop what he's doing, get on the floor and play with that child. Don't put that child in front of a television for hours at end. A child of that age would do very well with sensory play. So things that make noise, things that roll, things that can make color or are squishy, that kind of thing. So to have a bin full of lots of things. I remember when my children were that age, I used to like them sort of weaving pipe cleaner through colanders. That would keep them busy while I was making dinner. But a child that age needs a reconnection with that parent every hour. Absolutely.
Roger is writing about what advice you might have for parents who have children with autism. He is one of the grandparents, he says, worried about how autistic kids are doing with the lack of routine and organization of activities that they need. And so if you are a parent of a special needs kid or a child on the autism spectrum in particular, what guidance might you offer on that, Dr. Roberts?
Well, I think the thing that's most important is to have the sensory stimulation around that child be very modest. We don't want for that child to have any loud fire alarms or anything that is safety related that is not yet at the beginning sort of explain to the child that that's going to happen. What I have noticed is that the children on the spectrum that I work with have found this to be actually something that they can manage quite well. They don't have to have a lot of interpersonal conversations, which can be stressful. They enjoy being at home. They enjoy being with their loved ones. That whole situation has been a little bit of a break for children on the spectrum. The number one thing I would say is keep stress down, keep stimulation soft, and make sure that expectations when you get back into the school system are very clearly outlined, at visual agendas, so the children know exactly what's going to happen and when it's going to happen.
And finally, from a viewer, Dr. Roberts, Laco wondering, you said that children are resilient, our little ones are resilient, so this will be reassuring, I think, to Laco. My daughter is 18 months old, Laco writes, and I worry about all the normative socialization she would normally be receiving, playing at a park, meeting other toddlers, etc., but cannot because of pandemic restrictions. What can I do to ensure my daughter's development stays on track?
Sing to her, read her books, clap, take her on nature walks, let her talk on the phone to aunts and uncles and grandparents, snuggle and tickle and lots and lots of sensory play, extended bath times with bubbles and toys, lots of reading, singing. But I wouldn't worry too much. 18 months old, if you are holding that fear in your heart right now, I give you permission to let it go.
That is a wonderful note on which to end as far as viewer questions go. But I'm just wondering, to conclude, Dr. Roberts, here we are on day 62 of the pandemic. We're keeping track of it, of course. And I'm just wondering, based on what you're hearing from parents, from children, the kinds of things and the questions that you are getting at this time, what is the best advice to parents overall, or maybe a parting message for them in terms of keeping their children's emotional well-being top of mind and also in tip-top shape?
Well, keep your worries separate from your children's worries. do not discuss your personal finances. Do not discuss worries that you have about, food shortages or supply chain shortages. Do not discuss any of that around your child. Keep adult worries in the adult realm and children's worries in the children's realm. And if I could say one more thing, when it comes to technology, remember that children need technology right now to socialize and to learn. So you're going to need to loosen up a little bit on screen time use. With the screen time that we really do need to limit is that mindless consumption. But when it comes to allowing children time to connect with people online, and in my book, that's just fine.